Dementia and Alzheimer. Dementia is a general term used to describe a group of symptoms that affect cognitive functioning, such as memory loss, problem solving, and language difficulties. It is not a specific disease but rather a set of symptoms that can be caused by various underlying conditions, including Alzheimer's disease. Alzheimer's disease, on the other hand, is a specific type of dementia that accounts for approximately 60 to 80% of all dementia cases. It is a progressive neurodegenerative disorder that affects memory, thinking, and behavior, and ultimately, a person's ability to perform everyday activities. Here are some of the key differences between dementia and Alzheimer's disease. Cause: dementia is a broad term that can be caused by several conditions, such as Alzheimer's disease, Parkinson's disease, Huntington's disease, stroke, and others. Alzheimer's disease, on the other hand, is caused by the accumulation of abnormal proteins in the brain, which leads to the destruction of brain cells. Progression: dementia is a gradual decline in cognitive abilities, which may occur over several years. Alzheimer's disease is a progressive disorder that usually starts with mild memory problems and gradually worsens over time, eventually leading to severe impairment in cognitive and functional abilities. Symptoms: the symptoms of dementia and Alzheimer's disease are similar, but Alzheimer's disease has a more specific pattern of symptoms. For example, memory loss is often the first symptom of Alzheimer's disease, while language difficulties and behavioral changes may be more common in other types of dementia. Treatment: there is no cure for either dementia or Alzheimer's disease. However, some medications may help slow the progression of Alzheimer's disease and improve symptoms temporarily. Treatment for other types of dementia will depend on the underlying cause. In summary, dementia is a broad term that refers to a group of symptoms, while Alzheimer's disease is a specific type of dementia with a distinct pattern of symptoms and causes. A proper diagnosis is essential for effective management and treatment of the condition. If you or someone you know is experiencing memory loss or other cognitive difficulties, it is essential to consult a healthcare professional for proper evaluation and diagnosis. What are the medications that could be used in patients with Alzheimer? There are currently 4 main classes of medications approved by the U.S. Food and Drug Administration, FDA, for the treatment of Alzheimer's disease. These medications work by increasing the levels of certain neurotransmitters in the brain, which can help to improve cognitive and functional abilities to some extent. The 4 classes of medications approved for Alzheimer's disease are cholinesterase inhibitors. These medications work by increasing the levels of acetylcholine, a neurotransmitter that is involved in memory and other cognitive functions. The 3 cholinesterase inhibitors approved for Alzheimer's disease are donepezil, rivastigmine, and galantamine. NMDA receptor antagonists. These medications work by blocking the activity of glutamate, a neurotransmitter that is involved in learning and memory. The NMDA receptor antagonist approved for Alzheimer's disease is memantine. Combination therapy: some patients may benefit from a combination of cholinesterase inhibitors and memantine. Other medications. There are other medications that may be used off-label to manage certain symptoms of Alzheimer's disease, such as antidepressants, antipsychotics, and sleep aids. It is important to note that these medications may only provide modest benefits and do not cure or reverse Alzheimer's disease. The choice of medication and the dosing regimen will depend on the individual patient's medical history, symptoms, and other factors. A healthcare professional should always be consulted before starting or changing any medication. Is it better not to use medication in patients with Alzheimer? Whether or not to use medication for Alzheimer's disease depends on the individual patient's medical history, symptoms, and other factors. While there are medications approved for Alzheimer's disease, they do not cure or reverse the underlying disease and may only provide modest benefits. For some patients, medication may be helpful in managing symptoms and improving cognitive and functional abilities to some extent. Cholinesterase inhibitors and memantine, the 2 classes of medications approved for Alzheimer's disease, have been shown to provide some benefit in clinical studies. These medications may slow down the progression of cognitive decline. delay the need for institutionalization, and improve overall quality of life for some patients. However, not all patients may benefit from medication, and some patients may experience side effects that outweigh the potential benefits. In addition, some patients may have medical conditions or take other medications that could interact with Alzheimer's medications, making them unsuitable for use. Ultimately, the decision to use medication for Alzheimer's disease should be made on a case-by-case basis, in consultation with a healthcare professional. Other non-pharmacological approaches, such as cognitive and behavioral interventions, may also be helpful in managing symptoms and improving quality of life for patients with Alzheimer's disease. Non-pharmacological approaches like cognitive and behavioral interventions in treating Alzheimer. Non-pharmacological approaches, such as cognitive and behavioral interventions, can be helpful in managing symptoms and improving quality of life for patients with Alzheimer's disease. Here are some examples of these interventions. Cognitive stimulation. Cognitive stimulation involves engaging patients in activities that challenge their cognitive abilities, such as memory games, puzzles, and brain teasers. These activities may help to improve cognitive functioning, slow down cognitive decline, and enhance overall well-being. Reality orientation. Reality orientation involves helping patients with Alzheimer's disease to maintain a sense of reality and awareness of their surroundings. This may involve providing cues and reminders about time, place, and person, as well as using familiar objects and photos to help patients connect with their past experiences. Reminiscence therapy. Reminiscence therapy involves encouraging patients with Alzheimer's disease to recall and share memories from their past. This may help to improve mood, reduce anxiety and depression, and enhance social interaction. Music therapy. Music therapy involves using music to stimulate cognitive, emotional, and behavioral responses in patients with Alzheimer's disease. This may involve listening to familiar music, singing, or playing musical instruments, and may help to improve mood, reduce agitation, and enhance social interaction. Physical activity. Physical activity can help to improve overall physical and mental health in patients with Alzheimer's disease. This may involve simple exercises such as walking, stretching, and gentle movements, and may help to improve mobility, balance, and overall well-being. Environmental modification. Environmental modification involves making changes to the patient's environment to reduce confusion, improve orientation, and enhance safety. This may involve using clear signage, reducing clutter, providing adequate lighting, and using contrasting colors to help patients navigate their surroundings. These non-pharmacological approaches can be used alone or in combination with medication, depending on the individual patient's needs and medical history. A healthcare professional or specialist in dementia care can provide guidance on the most appropriate interventions for each patient.